Thank you, and welcome to HART's regular Board of Directors meeting. If everyone could please stand, and we'll say the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. First order of business is approval of the minutes. If I can get a motion on. I have a motion to approve the minutes and a second. All in favor, please say aye. Aye. Any opposed? Thank you. All right, we have a public input. We have no one signed up currently on our sheet. Is there anyone in the public that'd like to make a public comment at this time? I see no one. Yes, ma'am.
I don't, on previous boards that I've been on, because you can't talk to each other during the course of the in-between meetings, we always had opening member comments or closing member comments to give either comments outside of the structure of the board meeting or observations or requests for additional information. I don't know if there's ever been any historical of doing that here, or when do members comment?
I would think, and I'll just go by what I think on the order would probably be under new business. Anything that might want to be discussed, would be my guess. We don't have our attorney here at the moment, but my suggestion is that probably is the best time to do it. I think that in my 4 years, and anyone else that's been here, or anyone that's been here longer, is pretty much how we've done any kind of discussion issue. But if there's any way that we can change the agenda, we can look into it and see if we might have a time frame in which we do that. And maybe we do it every quarter and do it that way, or maybe even have a special meeting concerning specific issues. Because we have done retreats before where we talk about specific issues, or we could do it on a either a monthly or a quarterly basis where we can talk about issues together in a collegial way.
It's really just topical information, like
Sure.
and I have a topic that I do want to bring up. It's not really in new business, but so if you assuming we're all in our HART hats for the month and you intersect with a bunch of different people and you have input, it might be, do we have any data on this? I don't know that it
Sure.
calls for a retreat or a special meeting I think that we should all be trying to move the ball forward on a monthly basis in terms of the plan. So I don't, again, on the State Board of Education, we always had an opening time for member comments, and some people would say I have no comments. I mean, if you don't have anything to offer, you don't fill
Sure.
the time, and it takes about 5 to 10 minutes. But I just didn't know if there was any historical here of doing anything where members could comment outside of the structure of the agenda.
Yeah, and I don't have any problem doing that. I think that probably is a good idea. I just want to make sure that, whatever the order of business we're supposed to be doing, we're not going to, this is not something different or new according to our charter. So we'll check into that and make sure that we can go ahead and go forward with that. Okay.
Stacy White had his hand.
Oh, I'm sorry, Commissioner. Go ahead.
Chairman, I was just going to suggest that we accept Ms. Shanahan's comments today during the new business portion of the agenda. I can make a motion accordingly if need be.
Well, again, I don't think that there's any out of order in terms of whatever comments she wants to make. She can make them now or at the end of the meeting, either way, whatever is her preference. So, and it's up to you, whatever you want to do. If you wanted to continue to make your comment, we could do it now, or we could wait until after we've gone through the rest of the agenda.
My only comment was picking up on things that we've talked about the last two meetings. We've got a legislative session that's going to start in less than a month, a little bit over a month. And where are we on a specific legislative plan to ask for either funding or support for particular programs, or, we've talked about technology. We've talked about a lot of needs and resource needs, but I'm not sure we've had a strategic plan for what we're doing. And they're already in sessions, and they're in meetings, and they're in their committee weeks, and I feel like we're going to miss this opportunity with a surplus in the budget.
Okay. Well, I think, if I'm not mistaken, and Ms. Egan can comment on this, I think our lobbyist is there now about specific issues that have been directed by us, if I'm not mistaken.
He is, and we've also met with most of the members of the delegation. We met with Senator Lee's staff last week. When we've met with them, we have spoken to them specifically about the Fairbox Regional Project. We don't have anything in the top 10 list on the MPO, so a strategy item for us next year is to get our projects in the top 10 on the MPO.
Right.
They have to be in that top 10 before they get into the FDOT budget. What the MPO is listed for us is fleet updates And getting new buses, of course, is fantastic, but it's not the big projects that we're looking for. So we do have to focus on that with the MPO this year. We've spoken to them specifically about the Farebox project because it is regional, and it's given us the opportunity to hit more legislators than we normally do. The specific request on that has been $7.7 million. Half of the project is already funded through FDOT grants, T-BARDA, and also PSTA and HART have the local funding. So we have met with them individually. We've talked about what FDOT funding has done for us with our late night weekend service, where we would be coming back to them for asks. We had a lot of interest from Senator Brandis about the pilot programs, both for taxis to supplement paratransit, but also this sort of filling in the last mile program for fixed route. And his interest was see how the pilot goes this year and come back to the session next year if we need additional money and funding for that one. Since we don't have the pilot running, we did not have a data set.
Got it.
And the specific direction was come back next year. However, if we have been meeting with them individually and making a request, and in conversation, our board members are not hearing that request coming up, clearly the message is not getting through. So there's absolutely benefit to sitting down with, an ad hoc, however we want to structure the committee, getting the guidance, I know Commissioner Merman had asked to be included next time we meet with an elected. If me meeting individually isn't getting it through, then we need to find a better way to go forward.
Okay. And before Commissioner Merman, we do have, and I hope that you've been receiving any of the communications from our legislative team about what is going on and what they've been working on. And if they have not been communicating with you, make sure that staff knows that so you can get informed of it. And any time that you would want to meet with the legislative team, please, make sure that we'll set it up and get it done because we want to make sure everyone who wants to be informed of it, who wants to be involved in it, is involved. And I think that that's an important point that you made previously. Commissioner Merman? Oh, okay. Commissioner Beckner?
Yeah, Mr.
Sorry.
Chair, just a comment back to Ms. Shanahan. I think, with my experience on this board and other boards, it's been most customary that any board member can bring up issues like a new business, especially if they want to direct staff and get information. So I don't know that we need to do anything special, but just all board members, I think, should just recognize and realize that you certainly have that prerogative, and new business would probably be the most appropriate place at the end of the agenda.
And Commissioner Merman, if you
Thank you,
like.
Mr. Chair, and I'll concur. Maybe you could just, and we do this at the port, when we get to new business, it also says commissioner comments after it. So if you could add that just on the agenda, commissioner comments after new business, so it doesn't require. I think this is the only board that I have not gotten an actual hard copy of the legislative agenda for session. And it does concern me because you're right, $1 million surplus, we need to be asking. I have met, Commissioner Miller and I both, you've got two good former legislators that carry a lot of influence. And I think that I just would like to see a hard copy of what we're asking for so that when we are talking to the delegation members, we have Hillsborough Days at the end of March that will be up there for 2 days making the rounds. And they'll be probably finishing up, getting ready to approve the individual budgets on the House and the Senate before they go into conference. And this is a time where we need to be aggressive and ask for what we want. I do know that I have specifically asked if there would be some planning dollars to fund a BRT demonstration project. And so there was a lot of interest to do something like that. And there is a lot of money in the budget this year. But I think we just need to be very coordinated. I think Justin needs to probably be in front of us before February to tell us what we need to be doing and preparing for as we go into session. So I guess maybe he could come give us a report. He'll probably be up there. Our next meeting's going to be when session starts, or the day before session starts probably. That's just my thoughts. We need to be aggressive.
Director Bergen? No? Mr. Jacobs?
Yeah, for instance, jumping in my car right after this meeting. I'm driving to Tallahassee, and I'll be up there for 3 days. You know, is it possible for me to hook up quickly with our lobbying team up there, just introduce myself, get any information they have, and when I'm walking around the Hill, if it's possible for me to interject into some of my meetings on some of the needs we have for what we're asking for, that would be an opportunity we have, since I'm going to be up there anyways. So, you know, I'd love to be able to, at least to talk to them briefly, even over a cup of coffee or something when I have a few minutes, and figure out what would be the best plan of attack to maximize time while I'm up there anyways.
Yeah, I think staff will be able to help you with
We
that.
can, and to make sure that we don't lose time, I can call around after the meeting. What would work best would be make sure I get it here. We've got the white paper that we sent you previously about the fare box needs for the Greater Tampa Chamber to weigh in on that, and that's what we sent to Senator Lee's office. So what we'll do is transmit the white paper we sent to Senator Lee's office, a little description of the pilot programs, and then the things that we are saying are in the pipeline that we would be looking for the next legislative session. We can get that out by close of business today, and I can just resend the white paper so you've got it. Is that an acceptable starting point? Do we need to be, just to make sure, and that's for today, and then beyond that, if you don't hear from me, call me, but I will call around to all our board members this week to make sure we're pulling it together. Obviously not to violate the sunshine. We can also try to pull together an ad hoc legislative committee. It was challenging to schedule the ad hoc follow-up for the committee structure and election rules, so I don't know how quickly we can pull that together.
Well, my opinion, and you know, the other board members can make a comment about this, but I think that, you know, the legislative needs that we have, I think that Ms. Shanahan's point was that we want to see some action in terms of what we're asking for, and that ask is in front of legislators, you know, forefront every single time we do it, so that every time one of us meets with them, I mean, as you know, from my, I'm on the advocacy team for the Suncoast League of Cities. We are in front of legislators all the time too, and I always talk about HART issues. So I think it's important. I think Mr. Jacob made a good point. All of us have connections or folks that we deal with on a day-to-day basis. So I think the idea is get the information out specific to each one of those asks, so that we're there and being good advocates for our agency each and
Okay.
every time we meet with a legislator.
And we'll get that out by close of business
Terrific.
today.
Melendez first, and then Commissioner Miller.
Thank you, Mr. Chair. I just want to thank everyone for their comments, especially Ms. Shannon. I think the intent and the motivation of what you're saying, I think, is very valid, and I think it's, I heard the word coordination, and I would ask Ms. Egan if you could send that. Obviously, you're going to copy everyone, not just Mr. Jacob. I think, you know, being coordinated to be effective, and if there is some money that we can get, I know there are a lot of people here that have a lot more experience, like the previous legislative experience, but I like the idea of all of us coordinating in the sunshine, which again goes back to Ms. Shanahan's point about talking here during this time. And to me, my sense is, in talking with folks, that there has to be that rational nexus, you know, the MPO top 10. So I hope that from an expectation standpoint, we can understand what we can expect, you know, and then articulate a good ask, and then if they see that from multiple people, that's what's going to be effective, you know. So anyways, thank you.
Thank you. Commissioner Miller.
Well, I don't want to offend anyone, but I think we're taking this a little lightly. The legislature has money, and Commissioner Merriman and I can testify that when they have money, they spend money like drunken sailors. Everybody wants, yeah, I'm saying, everybody wants their own project. And we should have been talking to our legislative delegation and other legislators in December instead of talking about the second day of February. The legislature is in session and committee meetings 3 weeks this month, and one of those weeks is appropriations week, and that's all they're going to be working on, nothing else but appropriations. We should have been talking to them a long time ago. My suggestion is that they're going to be there this week, next week, and the following week. The only week that they're home is the last week of February. That whatever information you're going to pass out to this body, you have a legislative committee that I don't know what they've done. I'm on it. I don't think we've done anything yet. If Mr. Jacob is going to Tallahassee this week, if we can open up his head and pour whatever we need to pour in there today, so he can go up there and make whatever connections he can make, that's absolutely perfect. But if none of us are going to be there between now and the last week of February when the legislature is home, some of us, if we can, need to make appointments to see them. If not, if we know some of them, pick up the phone, give them a call, and put in their ear exactly what we need. Because, the budget process is ongoing, but there's still changes can be made. There's proviso language can be added to certain things. You can actually hide money in the budget and get away with it, but you're going to have somebody to do all these kind of things for you. And we should have been doing this in December.
Well,
We
and
waited too
Commissioner
long.
Miller, if I'm not mistaken, and Ms. Egan can step in on this, that's been an ongoing process. That's already been done in terms of some of the asks that we had specifically with, through your meetings with the legislators concerning a lot of these issues we already were talking about what our asks were going to be. I mean, if you could just point that out in terms of what had been happening in the last couple months.
Yeah, we started, in December, we started meeting with the legislators and with the individual meetings. But to Commissioner Miller's point and the broader point, we have not sent any staff to Tallahassee
Right.
since 2009, 2010, early in the 2 CEOs ago. We have not convened or used the legislative committee aggressively. It's just not a process we've been present in. So clearly, we need to do a different process on that and get the ask going earlier and be talking about it in June. But it was the first year that we met with everybody from the delegation. Many of the members said, wow, we haven't seen you for 4 years, we haven't seen you for 5 years, who the heck are you? Which is not what we want to hear, at least we're having the conversations, but clearly, there's other things we need to be leveraging.
Perfect. Okay. Yes, Ms. Shanahan.
You know, one of the ways to maybe jumpstart this a little bit faster to take advantage of everybody's individual relationships is to get an op-ed letter or letter under Catherine's signature, under the chair's signature that says, HART appreciates the meetings that we've had. Here's our specific ask. Here's our issues based on a regional transportation, based on these issues, based on the VINIC program, based on whatever you want to throw in an op-ed, and then say, here's why we need the following things this session. And at least we all then have a document that's in the public. We can take, work our circles, and I totally agree with Commissioner Miller. I mean, and that's why I raised this in December. I mean, for those of us that have lived in this process, we're late, but I think there's still money there, and we should not let this session pass, and we might educate people this year and get something next year. I mean, it's a multi-year, it's not a one-time opportunity, but maybe you can get a quick letter written that, whoever could decide, whoever signs it, and then it's a public document that we can all then take and say, instead of a white paper that, I don't know how many pages it is, they don't read that. They want to know the 5 things that HART wants.
Yeah.
What are the 5 things that are line item budgets that they can slip in somewhere somehow? And I've talked to several of the legislators that you all met with, and they have no idea what our priorities are. I'll tell you that.
Well, I know that during our meetings, in December, that I met with the legislators, some of the things that we've talked about, some of the things that Commissioner Merman just mentioned, which is some BRT dollars specifically, and that's something that can be well coordinated and quickly done if the legislature sees fit to doing it. So let's, if I could, let's move on, because we have some people in the audience that are here as recognition for their employment, if that's okay with everyone else. Commissioner Beckner, go ahead.
I'm sorry, I just have one other comment. I'm assuming, Ms. Egan, that we have relayed our needs to our Tallahassee advocate, Mr. Day, so he's aware
Yes.
of everything that we need
And
monetarily.
he's been in all but one of the meetings we've had with the representatives and senators.
Yeah.
So, I mean, that's why we have an advocate there, although it would be helpful if each of us or any of us are going to be in Tallahassee to know what those are, but as long as he's working on it as well, at least that's the starting point.
And if I could, Commissioner Merman just kind of whispered it, well, not whispered it, I heard it. Anyway, get to all of us those priorities, make sure all of us know it, send it on to all the members so that we've got it to go forward. I would suggest that we continue to do, as Ms. Shanahan suggested, let's get a letter that is a public document that we can use that all the legislators know about too. So we know our top 5 priorities, and I think 5 is probably the most that we can ask for at any one time. Let's do it, make it quick and easy so that they know it, they've got it up front, and so we don't have to have any doubt as to what we are asking for during the session.
Okay, and to clarify, the content we have that's already developed will get out, again, before close of business today, then we'll liaise on a letter.
Sure.
And as quickly as we can get that out, that will summarize, distill down, be the much easier version to get through.
Absolutely.
We'll do that today.
Well,
Just one last.
yes.
You could also, once you get those 5 things and the 1-pager, You could add them to the county legislative agenda, also the city. We are happy to do that, to add that to our advocacy list. Again, that's coordination, people seeing that we're all working together, and I think that would help us go a long way. But I do know that there are a lot of separate discussions going on out there about different things, and they are asking legislators for different things. Streetcar, BRT. I mean, there's a lot of discussions going on.
Sure.
We need to be coordinated and aggressive in how we're moving forward.
Okay. I thank you all for the discussion item. Thank you, Ms. Shanahan, for bringing that up. The next item on the agenda is our Employee of the Quarter Awards and recognitions. Catherine, if you'd like to go ahead and do that.
Ms. Ruthie Reyes-Burkhart, our interim CEO, will be doing the introductions and sharing who is here today. Just a real quick comment. The day after the Super Bowl historically is a hard day for us. Let's consider most of our folks are normally up at 3 a.m. and the day after the Super Bowl, it's the same as pulling an all-nighter. We also had Gasparilla on Saturday, and an awful lot of our road staff was here making sure that we carried our, a lot of folks with very good service. So we made the line today. We had, I think, 13 buses, which didn't start, but our operators went early enough and vigilant enough that we got everything out on the road. So really fantastic service day. And I say that so when you look at this list, and a lot of these folks are either at work or sleeping in, we're not taking it as a bad sign. So take it away, Ms. Burkhart.
Good morning, board members. For the member that is here today, Mr. Ronnie Cole, if you would please stand. Ronnie Cole is our storekeeper customer service employee of the quarter, which is October, November, and December of 2014. As storekeeper, Ronnie was hired in July of 2001. Ronnie says that he's been infatuated with buses since he was a child. He enjoys working with HART because of the environment and the management. He has 2 daughters and 2 grandsons, enjoys football, golfing, fishing in his spare time. So we thank him despite the Super Bowl for being here today.
And Mr. Cole, congratulations on being Employee of the Quarter for Customer Service in Stores. Thank you very much. And Ms. Burkhart, I believe more.
Yes, we do.
Teams showed up.
So we have Teamster of the Quarter for the same period, which is Mr. Gary Nash. He's our transit supervisor for paratransit. Mr. Nash came to HART in August of 2015 as an operator and became a dispatcher in January of 2009. He is a recipient of the HART Star Award and a member of the emergency response team. For our operators, we do a monthly Operator of the Month since it's a very large group pool, and so we have Operator of the Month for October, Mr. Mohammed Darby. He joined HART as a service attendant in 1995, has a 2-year degree in law enforcement from HCC as well as a law enforcement certification. He worked briefly for St. Pete PD before returning to HART as a bus operator in 2000. He enjoys family time, at the beach, skating and bowling, and he has driven for HART for 14 years and plans to drive for 15 more. Mr. Richard Sherman for our November of 2014 is a paratransit operator. He came to HART in March of 2002. He's been driving for 13 years and may retire in 2 to 3 years. He retired as an Army vet after 25 years of service, and he's received many commendations from his patrons over the years with us. Operator of the Month for December is Twyla Smith. Twyla came to HART in December of 2004, has received several Safe Driver Awards in her 10-plus years with HART, and she also worked for 7 years as a school bus operator for Hillsborough County School District. Ms. Smith receives many compliments from her patrons as well. Maintenance Employee of the Month, Mr. Ricardo Fernandez. He's a master mechanic hired in March of 1989. He began his career as a Mechanic 1 in the maintenance department and now holds position of master mechanic. He has been previously awarded Employee of the Month in 2010 and 2012. An Employee of the Year and Employee of the Millennium. He has participated in numerous HART events and promotions.
And Ms. Burkhart, Mr. Fernandez, we had more employees join us this morning. So
I
Ms.
apologize. Mr. Fernandez. Okay.
Now, I have one question. How do you get to be Employee of the Millennium?
We had one millennium.
I mean, he doesn't look that old. I just want to.
We'll review that after, sir. And we have Maintenance Employee of the Month for November, Patricia Ashford, Vehicle Custodian. She was hired in January of 2010. Ms. Ashford received numerous safety awards and is a previous participant of Employee of the Month for the month in 2010. She has participated in several fleet maintenance barbecues and is also a member of the emergency response team and is an active member of the HART Healthy Wellness Program. And for the month of December, for Maintenance Employee of the Month, Jerry Allen, Master Mechanic. He was hired in June of 1988. Mr. Allen began his career at HART as a service attendant, worked his way up to a mechanic apprentice, a mechanic B, and a mechanic A, and now is a Master Mechanic. He was the Maintenance Employee of the Month in 2009 and has received various other recognitions for Safe Worker, HART Star Awards, and Years of Service certificates. Mr. Allen has also participated in bus rodeos and is a member of the emergency response team as well. Facilities Employee of the Month for October 2014, Felix Cortez. He is a general maintenance attendant. He was hired in March of 2011. Felix has received several Safe Work Awards and is a member of the emergency response team and overall loved by his team. Facilities Employee of the Month for November, Jeffrey Campbell. Mr. Campbell is a route maintenance attendant and is a previous recipient of the Employee of the Month for 2010 and 2012. He was hired in May of 2000. And he has also received several Safe Worker Awards and certificate. He has taken part in many HART activities, including Paint Your Heart Out Tampa, bus rodeos, cooking for the fleet maintenance barbecues, which we love. And Jeff is also a member of the emergency response team. I'm sorry, did I do that right? Yes. And Facilities Employee of the Month for December, Mr. Charles Harris, route maintenance. He was hired in March of 2004. Mr. Harris began his career as a maintenance general attendant and now holds the position of route maintenance attendant. He has several safety awards, years of service certificates, and participated in Paint Your Heart Out 2003 and 4 and past bus rodeos. He is also a member of the emergency response team. So we thank you, all of you
Very
who
much.
received your awards.
Thank all of you for your service. Thank you for your service to HART and to the people that you serve. Without you, you are an important part of the economy, an important part of their lives, and we really appreciate it. Thank you very much. All right, next on the agenda is a presentation from Mr. Michael Stevens concerning HART employer-sponsored benefits. Mr. Stevens.
Good morning, Mr. Chair, members of the board. Michael Stevens, Chief Business Enterprise and Safety Officer. Today's presentation is going to cover HART employee-sponsored benefits. Every year, we endeavor to provide the board an overview of our benefits program, primarily because along with wages, benefits is one of our largest spend areas. The second reason is, again, along with wages, it's one of the primary reasons that employees join an organization and one of the things that allow us to retain employees. Today's presentation is going to cover a few areas. First, we're going to talk about the current regulatory environment with some emphasis on the Affordable Care Act. There are many provisions as a result of the Affordable Care Act that kick in that have a significant impact on our benefits program. The second thing that we're going to talk about is our current year demographics, as well as our spend, and as well as the current year plan design. And then finally, we're going to talk about what's on the horizon. Where are we going to go with our benefits planning? Today's presentation is going to be provided to you in terms of the details by our senior manager for HR, Organizational Development and Training, Dara Shinevert. Dara's team is primarily responsible for administering our benefits program. So at this time, I ask Dara to come on up.
Thank you, Michael. Good morning, board members. Dara Shinevert, Senior Manager of Human Resources and Organizational Development. And as Michael introduced, we will be providing to the board this morning our HART employer-sponsored benefit structure. Okay, I was premature with the keyboard. All right, the Introductory picture for the members of the board today will be the current state of the regulatory landscape under current aspects of healthcare reform under the Affordable Care Act. As all of the board members are aware, in 2010, there was the passage of the Patient Protection and Affordable Care Act, effective March 23, 2010. And this slide actually shows the progression of all of the overlay and introduction of various regulatory concerns associated with employers offering employer health plans under the Affordable Care Act. Notably, between 2010 and 2013, when all of the employer mandates actually became ambulatory, HART made a determination to make a switch from a fully insured health plan to a self-insured health plan. And that was by design, after having read the legislation, knowing what was coming down the pipeline in terms of employers and their respective regulatory requirements in terms of the fee structures under the Affordable Care Act. So, based on today's structure, what we know is there are three major players in the regulatory scheme. First of all is the Department of Health and Human Services through their Center for Medicare and Medicaid. That agency is primarily responsible for policy and programming. The Employee Benefit Security Administration through the Department of Labor is primarily responsible for compliance and ensuring that employer health and benefit plans meet the aspects of the law. And finally, of course, there is the Internal Revenue Service under the Department of Treasury, who is standing by, obviously, to collect all of our regulatory plan fees. So what does it take in terms of HART making provision for a robust health plan that supports our employees in their health and wellness, and in addition supports HART's initiatives towards being the employer of choice? We have several external partners and vendors, not the least of which include our brokers, our TPAs through our health plan, our healthcare provider, our ancillary and supplemental insurance providers, the federal government, and on board with us for the first time, our actuarial services. Our internal business partners, upon whom we rely very heavily for the provision of benefits, include our finance division, which includes payroll and procurement, and of course my HR benefits team in compliance and leave administration and wellness is always busy. So, looking retrospectively at the state of the healthcare plan after the conversion from our fully insured to our self-insured posture, this slide is intended to depict what the agency would have actually budgeted in the event we had stayed in a fully insured posture. If you look at the blue bar for each of those fiscal years, you will see what the trending analysis would have been for purposes of ensuring our healthcare benefits from a fully insured perspective. The green bar, all the way to the right, represents our actual claims experience from a self-insured perspective. And those bars that say delta indicate what our primary savings have been as a result of moving from the fully insured to the self-insured model. This slide, I think, is of particular relevance when we're looking at the regulatory scheme under the Affordable Care Act. It may be difficult to perceive from the screen, but the takeaway from this slide is the difference in the regulatory fees as between a self-insured health plan and a fully insured health plan. And to be sure, the disparity is great. If you look at FY 2014, for a self-insured plan, the total cost of regulatory fees for us was $2,240. Had we been fully insured, the cost would have been $84,500. Moving to FY 15, our cost as a self-insured plan is $20,740 versus $460,500 for a fully insured plan. And these fees are primarily driven by the health insurance industry fee as a type of excise tax for those employers who obviously have brokers and fully insured plans. So what drives from the previous slide, and I guess I should go back one, as you'll see, our claims experience, even though we are self-insured, is increasing. What's driving that increase? Our cost drivers are primarily associated with our employee demographic. If you look at this slide from the right to the left, you will see that from 2011 to 2014, we have broken our population membership down by bands. And as of 2014, you can see that it has been a very incremental move to a lower age demographic for our population. And if you look at the chart below, you'll see that our greatest demographic spend is in the age group of 50 to 59, followed very closely by 40 to 49 years of age. In addition, in looking at our employee demographic, we do note that our average spend by age over 40 is actually rather static, but that our spousal spends, if you look at the slide below, are higher in actuality than our employee demographics. So marshaling this information led, of course, to our current landscape, which was our 2015 plan design. For the first time, HART has offered to its employee population an election between 3 different plan types. The first plan type was the newest entree to the group, our low-cost option with a health reimbursement account. The base plan options and the buy-up plan options were the same plans as have been previously offered over the course of the last 2 years. But in offering the low-cost option, which is often referred to as a high-deductible health insurance plan, we found that because so many more of our employees in the demographic don't feel it increasingly incumbent upon them to seek health care, and or perhaps they do not have chronic and continuing conditions, providing them the low-cost option was feasibly much better for their bottom line in terms of their out-of-pocket costs. So what we found was, with respect to this structure, we were also able to contain our costs as we pass them on to our employees. This is the 3rd year we have not increased the contribution cost to our employees. So our 2015 enrollment demographics actually represent that low-cost option with a health reimbursement account has been an effectively very well-received choice amongst our employee demographics. And as you will see from this slide, we have a 5% increase of covered lives over our population last year.
Oh, hang on a second, go ahead.
In that slide.
Yes.
Do you have something mislabeled there because, the back one, buy-up is 336. And the base is 221, but yeah, the bars are first.
I think that might be a bit of a graphic typo. So the numbers are actually controlling. So irrespective of the bar, please excuse that. The numbers are what we're looking at for the total enrollments.
The buy-up is at a higher rate.
It is. Thank you for pointing that out. And if you look at that comparison, thank you to Board Member Jarosh, then compare that to 2014 and our enrollment demographics, what you will see is that we had a 12.6% increase in 2014 over the previous calendar year of 2013. But you will also see, which we find is instructive, that the greater population elected the base plan in 2014 as opposed to the buy-up. But what is, I think, very instructive is that for the members who in this plan year elected the low-cost option, the majority came from the buy-up plan, which suggests to us that this is the most affordable methodology in order to make healthcare continue to be affordable. So what are we doing in terms of our cost containment methodology? Because as I indicated earlier, our claims profile is increasing. In this slide, you'll see a publication on the key industry findings in 2014 with respect to employer health care plans. I would point your attention to the second bullet that indicates that increasing an employee's plan contribution was the most popular healthcare containment cost strategy in 2014. Obviously, HART rejected this for the third year, in keeping with our CEO's philosophy of our being an employer of choice for the benefit of our employees. And finally, in the last bullet, also note that employees seek more comprehensive wellness programs, and 44% of employers have a wellness program, which unfortunately has us still in the minority. But the good news is of 61% of these employers, their wellness budget is less than $10,000. Through very stringent negotiations with our healthcare provider, we have a $50,000 wellness program. So what does that look like in terms of a holistic approach to our cost containment strategies? 3 approaches. First of all, the plan design. Again, for the first year, having offered a third plan type to decrease and minimize the cost to our employees, and also to help to migrate our healthier population into a lower cost claims exposure for the agency. We also have a stop loss agreement that caps our aggregate liability on individual claims at $150,000. And for one particular catastrophic claim that we have been following very closely over the last calendar year, we have negotiated a laser so that we can remove that claims experience from the general population, so that as we go back to the market this year in order to bid the next healthcare provider for a multi-year contract, we can reduce our claims exposure by taking that laser out of the employee demographic. Analytics. We have been very, very closely aligned with our broker and our healthcare provider in drilling down on the data analytics. Of course, de-identified PHI, to make sure that we understand how we're trending various and significant health conditions, as well as our pharmacy costs, and as well as other corollary costs, such as our emergency and urgent care costs. What we have learned from this analysis is that the driver here is continued and increasing education. And to that point, we have stepped up our game with our wellness program, as we are now looking to move from the participatory wellness structure to the health contingent wellness structure that says if you want to live a certain lifestyle, you are going to have to pay a premium for the benefits that you receive. However, we are taking this as a slow walk amongst our employee population because it is a big paradigm shift. So as we move from that analysis, I'm sorry.
No, and thank you for that point, Ms. Chenevert. Just to highlight the reason we have the 3 plans this year, this was our introduction of the high deductible health reimbursement account. We wanted folks to have the opportunity to have the 2 plans with which they were familiar, with which we had the greatest experience, but introduced the new cost savings plan. We did an awful lot of training from Dara's team, thank you very much, during enrollment. So we've seen a lot of folks choose the less expensive plan. The schedule this year is back in March. We'll be going out to employees to get their feedback on what this health plan means for them and start that process of walking into where do we land for next year. We didn't want it to be, as Dara's indicating, an abrupt shift. We wanted folks to know what was coming and have ample opportunity to know if they wanted to get into the more expensive program that they may previously have been enrolled in, they were going to be in our wellness program, or they were going to practice smoking mitigation, or they would be taking other steps. And our wellness program has been extremely popular.
It has.
And we've seen a big shift with our operators. Consider over half our employees are paid to sit and drive 8 to 10 hours a day. And they do not have access to microwaves, but they have access to Burger King. This is, and it is industry-wide. We are not unique in this. So in addition to the wellness program, the 5Ks, the yoga at 21st, which was on Friday, the healthier snacks, the vending machines, the workout rooms and equipment at every facility, we're bringing it all together to not just be nice about it, but to remind folks that it impacts the bottom line. And when we are negotiating salaries, the more money going into an expensive benefit package is less that we can put into other benefits for our folks. Thank you.
Thank you. And so let's talk about Ms. Egan's perspective and our plans for wellness. First of all, we know that wellness and enhanced wellness initiatives are not just good for our employees, they're good for our employees' families as well. We showed a previous slide indicating that our biggest spend is spousal, as between our employees. So one of our approaches this year with our enhanced wellness programming is to encourage participation with our employees' families, their spouses, and their children. So that is part of our strategy for enhanced wellness education, also enhanced participatory wellness programming. The transition to a health contingent plan is not going to be easy, and it's currently under a sale in the Honeywell case, where we find that the EEOC is suing Honeywell Global for compliance with the Affordable Care Act under the wellness plan, and Honeywell Global is shouting, well, wait a minute, Department of Health and Human Services, our plan is compliant with your code regulations. So these are the landscape issues that we're grappling with as we make the transition to the health contingent program, and we're watching that case very closely. We do have an enhanced wellness calendar of events. They are highly publicized and extremely well received, and we are finding greater and greater participation in our new participation point system, which is our last bullet, and this current slide. What you'll see is we have shifted our structure so that now our employees participate in a point system. The more events you participate in, the more points you get. So instead of incentivizing our walks and runs alone as a methodology to encourage some of our employees to walk, now we're increasing the pool of participants by engaging them in this point system and giving those point rewards to those employees who participated most greatly in our wellness programming. And of course, to obtain the points, we are going through the wellness initiatives this year, starting again with Mission Slim Possible 2, which is an aggregate of body mass percentage loss, where we have rather exciting team-spirited competition. And we are also doing some very fun things we haven't done before. We will be participating in the Sports Fest on Clearwater Beach. We have now on-site yoga classes that we find the demographic is very interesting. It is very attractive to all of our employees. And in addition, we're also doing financial wellness planning because, of course, we find that the stressors of economic situations on the home front also detract from an employee's ability to be constructive and engaged in the workplace. So for 2015 to 2016, we have some initiatives that we'd like to discuss. And these are in keeping with our CEO's vision of the employer of choice modality. First of all, the City of Tampa is way ahead of the game on-site healthcare facility. We'd like to look and explore with them the options of actually participating collaboratively in something that will give us an entree to at least cost out and do a cost-benefit analysis for our population. Again, predictive analytics, big data to the micro level. We are constantly engaged in claims review so that we are fully cognizant of the trends we are facing in our employee demographic. Concierge medicine, we're already doing it with Cigna, And we are definitely, Commissioner or Board Member Jarosh has asked us previously, whether we are exploring that on a greater plane. And the answer specifically to the question of telemedicine is yes, we are. Because the cost drivers are coming down significantly, because now there is increased competition in the telemedicine field. Further down the road, we are also exploring and investigating our options towards increased benefits participation by offering a domestic partnership feature to our benefit structure, and we will continue to evaluate that as an opportunity for our employees. And finally, of course, with the current state of the federal regulatory scheme for FMLA as well as state law, of course, our doors are open for all of our same-sex partners who are legally married either in the state of Florida or in any other jurisdiction that legally recognizes same-sex marriages. And with that, we hope that this gives you the information that you'd like to be more informed, and also to understand that we really are committed to incentivizing the good health for our employees.
Ms. Shanahan?
I just went through this with my company. Is your low-cost option, this is the first year you're offering it?
Yes.
So your base plan, so your buy-up plan is your out-of-network plan?
It's in network, but it's at the 90-10 premium split. So it's actually less cost out of pocket to our employee population.
So what percentage of your employees are covered?
100% who seek coverage after demonstrating that they don't have it elsewhere. For instance, TRICARE, Medicare, and the like.
And then what percentage of your employee spouses are covered, or families?
I would have to get that specific percentage back to you. I can.
So is your driver, I mean, I think it's a great plan. First of all, I should have said that. I think you've got a very comprehensive plan here. The wellness, $50,000 is a lot of money. Are you driving that to some expectation of savings in the plan?
Yes, we are. And as yet, that ROI seems to be still elusive. I think most employers are looking very seriously to be able to demonstrate the ROI connection between their wellness plans and their cost decreases. But what we know is that it simply makes good business sense for several reasons. First of all, our employer or employee demographic is very receptive to it. They alone are most familiar with their individual health conditions, and I think there is an overarching feel that they want to improve. Secondly, in terms of cost containment, when we go to the market, now that we have 2 full years of claims data, we have to be able to demonstrate that we are a competitive risk. And if our claims data is out of whack, we are going to see it when we procure these benefits in terms of the offers we receive during that process. So several reasons for us to really go after the money for our wellness initiatives, so we have the latitude to get all of this holistic approach funded and provided to our population.
Thank you.
Thank you. Any other questions? Mr. Beckner?
Thank you, Mr. Chair. Dara, what's the percentage of the employees that participate in our wellness program?
It's still relatively low, and I think that you have to break it out in terms of the really proactive physical events versus the, I call it as a trainer, butts and chairs issues. But I think we're trending towards about 20 to 25% of our population who is embroiled in one or another of our various incentives and wellness initiatives. So we're seeing increased numbers in our populations, but we're still literally beating the trees to get more employees signed up.
When you talked about the on-site health facility, what's your vision, or what do you expect to?
Well, I think that there are probably several ways to do it. For an on-site health facility, it would be wonderful to have an ARNP or some other level of non-physician, state of Florida certified and licensed, to be available at peak times during the day, where our almost 24/7, 365 operation suggests we have the highest deployment of our employees, at which time that person would be available on site so many days a week, so many hours a day, preferably at no cost to our employees. The problem is that in terms of space allocation, I think we're spaced out. And so for purposes of doing that kind of on-site collaboration, it may very well look like a mobile unit. And it may very well be an area dedicated to Director DeRoche's point, an area we can practice telemedicine via webcams and the internet. So still under consideration in terms of the best latitude for how we could craft that option.
You may want to speak with the sheriff's office. They have gone towards that way, and I don't know the extent of the medical staff that they've got, but they're doing a lot of their own evaluations and those types of services.
Captain Privatera is still there?
And finally, did you say, do we have a fitness facility, or do we have relationships with local gyms or something to offer to our employees?
That's a great question. We do not have a per se fitness facility, certainly not of the type that you would imagine having if you paid monthly for the benefit. But certainly we do have a fitness area within our operations unit that has ellipticals, treadmills, has on-screen for people to watch while they exercise. But that is fairly well the extent of it. We are now engaged in trying to negotiate some benefits with several of our external healthcare or fitness businesses to find out if we cannot negotiate a decreased rate for our employee population, so that if they cannot get the fitness and the wellness and the exercise on premises, at least they're incentivized to go elsewhere and pay a reduced monthly benefit in order to have access to that ability to work out.
That was going to be my suggestion. If you look at the LA Fitnesses or somewhere where they have a lot of different facilities. around the
Exactly.
county.
LA Fitness. That's right. And we do already have the YMCA discount that we've
YMCA,
already
right,
done. In addition, there's, of course, UFit, Orange Theory. There are a number of different companies there who are willing to at least discuss the possibility of having some kind of negotiated discount with our employees.
Okay, thank you.
I was just going to remind about the YMCA. We do have a deal on enrollment.
We do.
And it's good at any of the Ys in the county. And in fact, our director of risk and safety teaches at the YMCA 3 days a week, so you can get double the exposure.
He does, and I hear that that's particularly brutal, so I won't be attending.
It is not for the weary, which is why he doesn't see me.
Any other questions or comments? Mr. Jacob?
This is terrifically comprehensive, and like Ms. Shanahan, my company's just going through the middle of this as well. But when I look back at your member demographics and see that 65% of the employee base that are enrolled are 40 years or older, that presents a different challenge. And so when you look at moving forward in terms of predicting costs associated with an aging
Population.
employee base, it's a double-edged sword. I mean, you have an aging employee base, but it also tells you it's a great place to work because you have people staying here for a long time.
Well, thank you.
So you have two different goals there. But I'm curious, in terms of this wellness program, are you seeing the insurance industry starting to look at that as a basis of keeping your costs lower by percentage of membership in the wellness program? Is that something from a standpoint of going back to the insurance companies in terms of negotiating premiums?
That's an excellent question, and the answer is absolutely yes. Insurers, and particularly those in the market looking to assist self-insured employers, are very keen on seeing aggressive wellness programming in an effort to parallel cost containment modalities. So we found that in having a more aggressive wellness program, that will be more assistive to us as we go back to the marketplace to actually price out and award the next contract for the provision of healthcare services, which is a big chunk of our budget every year. So yes, to your point, absolutely, it makes a big difference. And in addition to that, yes, you're right, from a retention strategy, our employees, who have also been honored here today, like it here. And we like that they like it here. But we also realize the challenges going forward in that the millennials are coming into our workplace, and we welcome them. But we certainly have to have programming and other content and employer options that are attractive to that group as well. That will additionally continue to decrease our age demographic for those employees who are over 40 years of age. So thank you.
Great. Any other questions or comments? Okay, thank you very much for that, and thank you for participating with the city to try and figure out about on-site. And
Very
our
interesting.
our clinics have been a great success for us in terms on a year-to-year basis, in terms of the amount of money that we've saved. We've cut down on the rise of our coverages in terms of price by having those there. So thank you for doing that. We think it's a great idea.
Thank you so much for the opportunity.
My pleasure. Okay, next is an action item. Jeff, if you want to explain that action item to us so we can vote on it. I think it's pretty straightforward in terms of the way it reads, but we'd rather have you do that.
It is. Good morning, Jeff Seward, Chief Financial Officer. Yes, it is a routine authorization to approve a banking resolution and our required certificate of incumbency by our bank, Bank of America, due to the changes in board leadership.
Terrific.
Move approval.
Do I have a motion and a second? All in favor, please say aye. Aye. Any opposed? Thank you, Jeff.
Thank you.
Quick and easy. We like that. Next up is Chair's report. I don't really have anything to report. We've been working, of course, on our policy leadership group. I think that we, now with PB going in and doing the public portion of this, I think the next steps over the next couple of months are really going to be very important for us as to where the county wants to go in terms of transportation and our citizens. So I'll lay off on that in terms of what we're going to do next. So I think that's probably the next couple of months we're going to have a better idea of where we're at. We're going to expand it. It looks like we're going to have quite a few places in which people are going to meet. So it should be pretty interesting as to what happens. Ms. Shanahan.
Can you make sure all those dates and locations are shared among all the board members
Absolutely.
immediately upon a notification?
Absolutely. I think this staff will get that out. I'm pretty sure that they've got, I don't know if they've got all of them set, but I think they've got they've got some of the sets.
They're
Yeah,
working on the final locations.
because they had to get some more locations as well.
They had to add
Yeah.
locations. I'm not sure how final the list is, so we've got something we can transmit as draft,
Okay.
and then we'll get the final one out as quickly as possible. I'm also not aware that they've set the time. Previously, the recommendation had been 6 to 8. Our observation from HART is when we have meetings start at 6, people who have gotten home are not coming back out.
Yeah.
But if a meeting starts at 5:30, if it's open house, people will stop by on their way home regardless of who's in the car with them. 6 o'clock was too late. So there was discussion of moving the meetings to 5:30 to 7:30. We have a commitment that HART will have probably 2 staff members at every meeting. We also are not certain what exactly the training is which is being offered. So regardless of what the county is doing with their consultants, we'll do something here in-house to make sure that we have the same message and that we are consistent. We're also using this information, these meetings, as a foundation for the TDP update this year. There's no reason to go back out and get more information. This also ensures that through budget development, the TDP lines up with what this long-range plan says. So it gives us an opportunity to get, audiences that would not normally come and talk to us about our projects to get their feedback. So we're excited about it.
Terrific. Okay. Next up on the agenda is the CEO report. Ms. Egan? Huh? Oh, you can go ahead and do that. Yes.
Yes,
I'd
sir.
like you to do that.
Yes, sir. Where's the streetcar going? Well, yes, ma'am, we'll get there. First, Mr. Carino has stepped away, but he is back on the board. He was reappointed for a 3-year term or a 4-year term, Lena? 3-year. So congratulations on his reappointment. We received the notification from the mayor's office later than our CEO update went out last week, and I apologize for that. Again, the CEO Weekly should be coming in every week, but just a quick recap, working backward. We had Gasparilla on Saturday, and we'll get you the ridership and revenue numbers on that once they are available. We every year, it's a new system for us, and based on the feedback from this year, we're probably going to be looking at some point of sale changes. So I think many of us have gone to an evening meeting, an event, where somebody has a reader plugged into their smartphone, and they're reading the credit card. So we're going to be looking for an app that will allow us to use that in lieu of the TVM payment and use that as a way to collect our ridership data so we can speed the boarding we for streetcar and for the bus side. Just a few other things we'll be looking at. We'll keep you posted as those develop up. We attended the Florida Public Transportation Association quarterly briefing in Orlando last week, and that was good for best practices. We talked to some folks about CNG, and we may have another partner for the fare box procurement. We, thus far in fiscal 15, are on track to recover about $300,000 in subrogation. We recovered $31,000 in December alone. So it's a big achievement for us, a change in how we've been doing business. And if there's questions, I will volunteer Michael Stevens to answer those. We met, previously noted, we met with Representative Cruz on January 13th, and January 27th, we met with Senator Lee's staff. Senator Lee was out. We talked about getting the fare boxes in particular on the list for the local funding requests and the difference between local funding requests, which were separate appropriations, and tucking something into the FDOT budget. I was seated next to Commissioner Merman and facilitated by Mr. Jacob on the Leadership Tampa panel, talking about transportation. It was a great conversation that we had. On the 7th of January, we hosted our first of many to come appreciation lunch for our 30-year veterans. It's in the past 4 years, part of cost containment, we have eliminated a lot of appreciation efforts. So we have reconvened, and this was the first time that we had a lunch for the maybe 12 folks who were able to attend. It was well received, and just a small thank you for the folks who've been making our service possible. We've had folks who've been here 40 years, and it's just incredible to think about them coming here every day, considering they started their careers at 3 in the morning and they run till 2 in the morning. It's a big accomplishment. Headed up, we have the bus rodeo coming on February 28th. This is our first rodeo in 6 or 7 years. The winner of our rodeo will go to the state rodeo in St. Petersburg in April, and the winner of the state rodeo will go to the international rodeo in May. Given it's our first year, I don't know that we're going to international, but we have a big event coming up. It's an event we don't notice it as a public meeting. If board members are interested in attending, we have to make sure that we have you in and out when another board member does not attend. Otherwise, the whole thing's open to the public. So if any board member would like to come in, and I don't know that we're all driving 40-foot buses, but just hang out for a while, please coordinate with the executive office, so we'll keep everybody separate. Am I checking off that? And then the final item is from Councilman Suarez's direction to talk streetcar. The mayor's office hosted a meeting on some things streetcar, not all things streetcar, on Friday afternoon. And it was specifically, what are the options that are out there to do something with the streetcar? We've stated before here that HART provides the staff for streetcar. We are the operator. So we go beyond the operator's agreement, but we are making sure it's operated to the best of our ability. For cost containment, we've brought some of those costs over to HART because the service has to get done well. We're judged by it whether or not we own it. We're still judged. So my time, for instance, the CFO's time, are not going in the bill to THS. Overtime for Gasparilla is not in the bill to THS. These are things which we absorb. Conversation Friday talked about the structure of THS vis-a-vis the city and HART and the operator's agreement and the terms on that. Also talked about options for increasing frequency on the service and how quickly that could go in, what would be an optimal time frame for a pilot program. Staff recommendation from us, a pilot program that kicks in the summer isn't really representative because it's not a strong season for tourism. And when you're concerned about air conditioning, you're not thinking about transit. So conversations focused on pilot programs potentially kicking off in October. That would be a robust schedule starting at 6:30 a.m. running till 10 o'clock. And we have the vehicles to do this. It would take us a little staffing and going through our union process to make sure we're hitting the right markups. Also discussed were funding options for possible expansion of the streetcar in the future, how this lines up for state or federal grants, how this would line up for Tiger grants, what funds are available. I had some discussion about CSX crossing modernization. So pretty wide-ranging conversation. So for the folks who like streetcar, it is encouraging to be thinking about this being treated as a mode as opposed to a tourist attraction. It's been very popular with tourists, interestingly enough. We've had 2 cruise ships in January. The Ida Vita, I believe, came to port twice. The first time she came to port, our ridership on streetcar was 1,700 trips. A representative Wednesday is about 570 in this quarter. On the second trip, it was over 2,000 trips. It was actually almost 2,200. That's more than a Saturday. So on a Wednesday, the tourists have really been using the service. And good fare recovery, anywhere from 2 to 2.5 times what the average Wednesday fare recovery is. So is it paying for itself? Depends on how you slice and dice it. But obviously, when you get the service out there and folks are in town, they will clearly use it. So it's been nice to build on that success with this critical mass of conversations, the HDR report, the Vinnick development, potential port redevelopment. And I'm sure I'm missing something.
I don't think so.
All right.
I think that's it. Do you have anything else?
No, sir, I think that's enough.
One last thing about the streetcar. All the discussion in terms of funding was not about funding that came either directly from the county or any other source. It was about all sources and not specific. So, it's a work in progress right now. So we'll figure out what the next steps are going to be. But it's going to be pretty heavy lift in terms of the city. So, and that's kind of the direction that we're going right now. Okay. Thank you.
And
I'm glad she knows that I have broad shoulders, that I can do it, so.
And Councilman Ivey
Thank you,
Camp.
Commissioner.
We do have some fiscal 15 budget information cards, which are available. We distributed these at the last board meeting, but we do have additional. So if you'd like a spare or one in the first place, please let us know and we'll get them to you. Thank you.
And they're extremely helpful, especially when reporters want to ask you, what does HART do, and where does the money come from, and where does it go? It's a great way of giving them a visual as to what we're doing. Okay, we have our regular reports are in the back, and our backup material. Next up is our general counsel report. Campbell?
Nothing to report today, thank you.
Isn't it great when you have to pitch it for someone else and you really don't have to do anything?
On a half hour's notice, it was perfect.
Thank you for being here and helping us out on that. We have one person that would like to speak as part of the general public, Mr. Gary Cloyd. Sir, if you are here, if you could come up to the microphone and please state your name and address and go forward.
Good morning, board members. Gary Cloyd, 1402 Chilcoot Avenue here in Tampa. Wanted to take a few minutes and point out some things that have been brought out at the last meeting and kind of get some input, and hopefully with all the maintenance and operating costs that new people have to face on an everyday basis is challenge enough. Now, I've ridden HART in streetcar since June of 2008 with a couple of years that I was up in D.C. studying public policy. And to ease congestion, while I was in Orlando for New Year's, the shuttle service that runs in conjunction with the Sunrail, I'm trying to find out from a lot of people, and I've made phone calls and can't really get an answer. With Raymond James Stadium and Amalie Arena, is there anything holding HART back to run a shuttle service from different parts of the area? And the people that I asked brought up 4 areas: the Brandon Mall, Citrus Park Mall, Northwest Transfer Center, and Britton Plaza. And as a pilot study with football season starting in August, I'm wondering, they run shuttle buses, the charter buses, over to the parking lots at Raymond James. So how feasible would it be with all this congestion on 275, Dale Mabry, and that kind of thing? Would they be looking at possibly putting that out there and see if people would actually ride it? For the streetcar, I know last week there was a German cruise ship in, and I think 5 of them were at full capacity. So that'll give you an idea. And to scale back the time and maybe the price might be something to take into consideration as well. If you get a 3-day pass, I believe it's $11 per tourist. There's some promotional things during the year for 25-cent trolley rides. So I wanted to bring that to the board's attention because with new members on here and a lot of interest in public transportation being on the ballot next year, this feasibility study, I'm sure somebody would like to pick it up and find out if we can do some things. Thank you.
Thank you, Mr. Floyd. If you want to answer that question, Ms.
Yes,
Egan.
and thank you, Mr. Cloyd, for your comments. We are bound by FTA charter regulations and broadly put out there, we cannot use our resources, our publicly funded resources, to compete with private industry. So if there is any other firm which is capable of providing a bus service from a private venture, which we are operating publicly, we are legally precluded from competition. Previously, the FTA had allowed bus agencies to run service very similar to what they ran during the weekday to supplement, I'm thinking specifically my Baltimore experience, to Raven Stadium. And they were running for a $10 fare, which was well outside the base fare. FTA, responding to industry feedback, tightened up on that in the 2008-2009. The charter providers were very outspoken that they saw this as competition. What we can do is run the service which we currently run free. We can be supplemental trips. It cannot be bought. It can't have anything higher than a regular fare. Mm-hmm. One of the challenges that we've always had with serving the Dale Mabry area is the city of Tampa closes the streets, local streets, and they close our West Tampa transfer facility to traffic. So service which we have over there is dropping everybody behind St. Joe's, and then there is the hike from there. There are private providers which do that service. So we're very precluded in what we can offer. The streetcar is a little different because these are our cars, and it is a publicly owned right-of-way, and there is no competition. So we are able to charter the streetcars when that market is available. We would love to be able to get out there and provide more service, just we have that legal block which keeps us from doing so.
Thank you. All right. Is there any old business to be presented? Mr. Bergen.
I have a question. A few months back, I had raised a question about signal. Did we get any feedback? Or did I miss it? I may have.
It was in last week's CEO Weekly. We did actually work with city staff and condensing down. Marion Transitway is part of the downtown grid. So when the city looks at timing on any of the streets, they're looking at the impact on the cross streets. And one of the things which is a little problematic for the HART ridership is you're not factoring then a constant flow on traffic. You're factoring in if a bus is making a stop, if a bus is hung up behind another bus making a stop. So any modifications would have to be weighted against the impact to the whole grid. Passenger activity makes it a little wonky. That's a technical term, I understand. But the City of Tampa staff did graciously say they would go back and reevaluate and see if there was something which could be done for future use. So we did touch base with them, and we understand that we are not the biggest piece, but we are an important piece, and we'll continue to stay on them about that.
Thank you for the inquiry. I look forward to the future feedback.
Thank you.
Okay. Any new business? Oh, Commissioner Beckner.
Thank you. I've been reflecting, when we had the employee recognition awards earlier, and I got a couple questions for staff. What's the rationale that we only do that on a quarterly basis?
Depends on the work group. With our operations group and our maintenance group, we do operator and a maintenance employee of the quarter. They are much larger work groups, not quarter, of the month. The areas where we have employee of the quarter are smaller groups. So Mr. Cole was recognized as employee of the quarter for stores and for customer service, and I believe that work group is under 25 employees. So rather than go monthly and end up having somebody pop up as employee of the month, not that we wouldn't love it, every 2 years, and by way of comparison, a bus operator may have an opportunity to qualify once every 10 years. We went with quarterly to keep the recognition on parity. It's just because it's a smaller work group.
Okay. The reason why I asked it just seemed like this morning it was rather rushed. And so, I think the presentation was fine, but I just think for the work that they do, there should be, that's what I was wondering, if maybe a monthly employee recognition is possible. And do they get any other perks other than the recognition up here at the board?
Good morning again. Yes, they do. The employee of the month and the quarter are incentivized financially. So they do receive $100, which of course is taxable to the employee. But yes, we do that. And to Ms. Egan's point, we are retooling the employee recognition program because we share the sentiment that they should be acknowledged and recognized more frequently than every quarter. So that is under consideration.
And I thought maybe, and I don't know if you do this or not, but maybe if they're coming here before the board, maybe having a photograph and then placing them on the wall or something like that, and have employee recognition space where they can be recognized throughout the year, and just other perks. I just thought that we need to have a little bit larger spotlight on our employees of the quarter and the month.
Yes, sir. And Ruthie Reyes-Burkhart's been working on the facility side on reserving some parking places at 21st. Yeah. Parking's a premium. Yeah. So employees of the month would have the monthly parking place, or of the quarter. It adds a little more value to the quarterly, and it's really important to them to not have to walk from pretty much the Hillsborough County Schools parking lot, which is what you get when you're out there. So we will continue to enhance it. It's been interesting to see the staff's reaction because it was gone for so long that once we started it back up, the attitude, it's been well received, and I don't know what the right adjective is. It's not that it's disappointing, but when you hear from your staff, like, oh wow, you guys do see the work that we do. It's clearly not what you want to hear, right? I caught the bus last week, and an employee said to me, "Are you going to do this every Wednesday?" I was like, "Why not say hi and good morning?" It's so we are definitely moving the culture to be more recognition focused and appreciate the work that folks are doing.
When do you think that program you're going to have that retooled?
So sorry, you caught me with a bottle in my mouth. We have been actually working on that pretty consistently so that we have the spine of a new employee recognition program, but we have begun working with operations in order to be more inclusive of an overall employee recognition plan. I think we can fairly shoot for the spring to actually release that as part of an agency-wide initiative, as opposed to doing it tangentially as between operational divisions. Because I think what we also want to do is increase that recognition not just to our bargaining employees, but to our non-bargaining employees as well. So a more comprehensive, collaborative approach across the agency is what we're shooting for.
When that's ready, could you bring that back for a presentation
I
to
absolutely
us?
could. Thank you.
Great. Thank you. Mr. Jacob, I think you had your hand up too.
Yeah, I just wanted to follow up on the streetcar issue. When the German cruise ship was in town last week, my office is 1 block away from the Fort Brooke garage stop, and I was out several times that day for walking downtown to business meetings, and it was remarkable. The lineup of people waiting for the streetcar at that stop was incredible. When the cars came, it was standing room only. It was pretty fabulous. But I think the more important thing was I'd like to contact the Tampa Downtown Partnership to see from their perspective what it did for downtown business, because I know the deli shops around there did a boom in business with everything. So the residual effects of having that opportunity for those folks who are visiting our city to, one, have the experience of riding a streetcar, which is pretty neat, but also to be able to go deeper into downtown and explore our city. It was pretty cool. I mean, I know I unintentionally got photobombed a couple times in people's photographs walking by, but it was remarkably different, and I guess there's a couple things. There are tourists are in town on a cruise ship, but I think also it was a demographic of people who are used to riding public transportation, which was also an interesting thing. So I think doing what we did was just terrific, and hopefully we can increase that and benefit from it greater in the future with those partnerships.
Okay, thank you. Anyone else? Ms. Shanahan.
Just listening to that, the other partnership is the food truck partnership. You can get these guys. I mean, if you're letting people know when the cruise ships are in and there's going to be higher propensity of ridership. Make sure that you're connected in through your blog and social media to the food truck guys, because they'll show up at those places where there's lines, and so the line is not so long or so boring.
Okay, anything else? Yes, Ms. Egan.
Quickly, just wanted to call everyone's attention. We do have our KPIs, which are set by the board. Historically, we start off the year with a bit of a lag on reaching some of them. We hit some of our expenses on the books a little earlier on. We have some on-time performance. Our heaviest months are October, November, December. So what you will normally see on our KPIs is not hitting all of them early on in the year. Complaints, we are behind. We are at the same level of performance from last year. We did adjust the KPI, so we're holding complaints constant, though we do have higher ridership. Also see a change in maintenance. You should start seeing those numbers pretty quickly. We've got some different management back there. We had introduced Vasti Amaro last year. She was a contractor filling in for van services. She's transferred over to maintenance. She has a very strong maintenance background. And if you've seen her in the past month, you've seen her in her steel-toed boots and her Dickies. So we've revitalized a lot of communications programs back there. The parts guys are complaining that they're constantly out of parts now, and I, of course, think this is a beautiful thing. So you should start seeing some pivot. Takes a little while in the maintenance numbers. And once we get more of those campaigns rolled out in that position and filled permanently, we'll have the maintenance staff come back and give you a briefing. But just wanted to get out ahead of that. The numbers are not great, but they're in the process of, they're where they go in the year, and we're looking forward to record-breaking ridership again, and we're going to hit these numbers. We're also pushing KPIs down in every division. So each separate department is in the process of coming up with what their 3 targets are to support these. So we are moving toward managing by objectives as opposed to it's Monday morning, what do I feel like doing? That was it.
All right, anything else? If not, we are adjourned. Thank you.